Hey folks, it's Spitz with Pixels and Pills at the Digital Pharma East Conference in Philadelphia 2012. It's my pleasure to have Lisa Flaiz, Group Director of Digital Innovation over at Jannsen. And we've seen lots of interesting things that are going on within digital health in general, a lot of stuff discussed at the conference today. What left a big impact, like a little bubble or a little light bulb that went off that moved you in a way that you didn't thought you could be moved?
That's a great question. There's been a couple of interesting tidbits over the last couple of days. I'm very pleased to see such a deep level of consideration given to mobile this year and the customer experience on a mobile platform and the things that people are doing to create a good customer experience in mobile. I also think that the presentation that we saw about how we need to move from messaging to engagement was a really great message to hear and to reinforce over and over again. We all say patient engagement or customer engagement a lot of times a day. It's a very popular buzzword right now, but that presentation that shows some really fantastic examples of how that's being done in and out of healthcare really helped demonstrate that it was possible to engage with our customers in lots of different ways. So whether we're providing a venue, whether we're facilitating a conversation, whether we're flat out participating in a conversation as a community manager, we're starting to see success in that, and even better, starting to actually put metrics behind what engagement looks like and how success can be defined. So that's something that I think is a big improvement over last year.
Talking about the definition of success, how we define engagement, we always talk about ROI, but I get the feeling that we need to transcend ROI. It's not just about impressions and click-through, not just about individual channel engagement, but it's about really reaching and making a meaningful connection to our constituents. Ultimately, it's about improving the quality of life of patients, and it's providing doctors with treatment solutions that make the most sense. How are some of the tools and technologies, especially some of the case studies that you've seen demonstrated over the course of the last couple of days, move forward the digital health community in a way that does get that result?
Right. No, that's a great question too. Well, for one thing, I think we are starting to think out of the box about success metrics so that it doesn't have to neatly line up to ROI measures, which of course still have a place. We're not going to get away from being able to show business impact for a program that we implement and put into market, but we're also starting to look at strategic metrics and engagement metrics that are more about moving the needle with the value we provide to a customer, and this is another buzzword, beyond the pill. In the 80s, Beyond the Pill was about disease state management programs that we provided to managed care organizations. But we've certainly evolved a long way since then, and now Beyond the Pill is about providing those things to a patient and their caregivers and their loved ones that help to impact the overall health outcomes. Whether it's quality of life, whether that's a kosher phrase or not, might be questionable in this environment, but the idea that it impacts health outcomes because we are providing value about that patient's overall health and wellness beyond just don't forget to take your pill. So we're seeing lots of good examples about contributing to a patient's heart-healthy lifestyle with nutrition, with activity level, with stress management, with support systems. And those are the kinds of content areas that the pharma industry is starting to play in a really meaningful way, and finally believe that we have a place to play in that conversation.
Yeah, that perspective of elevating the dialogue and looking at the patient and our constituents holistically is a theme that I've sensed resonate through too. And it's really about transcending just the tools and the technology. It's not just about building an app with the zeros and ones, but it's really about reaching out and making that connection. And along those lines, it's about the real people involved on the pharma side too, where there's a sense of infrastructure, there's a sense of community internally that needs to grow and kind of evolve with the shifts that are taking on around them. What's your feeling about how that's evolved and changed over time and kind of embraced this new digital world in a way that's refreshing and also welcomes a lot of the changes that are come to be expected?
Well, we heard a couple of times over the last few days that there's no such thing as innovation without risk-taking. But risk-taking in a environment like this does take collaboration, takes alignment, takes buy-in. So as much as we want to move things along very quickly and try out things that we believe will be successful and things that we believe we can scale across our organizations, we do have to make sure that we're mitigating risk as much as possible, and that means getting perspectives from multidisciplinary team members. But the good news is most people are really interested in doing this. Big Bad Pharma has a bad rap about the reasons we do the things we do, that we just want to sell more product. And the truth is that most of us who are involved in this area are doing it because we have an affinity to helping people. I could easily be marketing Oreo cookies or Mercedes-Benz, and maybe that would be glamorous and fun. But there's a sort of MD wannabe in me, and I have that same value in common with a lot of my colleagues. So we are all interested in doing things that we believe is for the better health and wellness of the patient and their families. And so when we pose new ideas in our organization that we want to try to push through, even if they're on the slightly risky side, we do it in a way that uses what's good for the patient as a lens, and of course try to find that intersection of where the business impact is. But we can pretty much feel confident that our colleagues will help us find a way to do it if we're able to show that we think it will provide value to our key customers, which are our patients.
Yeah, absolutely. One of the themes that resonate as well is the good karma of pharma, if you will, that it's not even like the high-end products like Mercedes-Benz, but destructive products like fast food, tobacco, which lack some of the regulatory constraints. There's a lot of good that pharma does across the board. If you look at what folks were dying from at the turn of the century compared to what they are in terms of contagious diseases, in terms of we're living longer, we're living better, and to a large extent it has to do with the good works that come of that, and some of these tools, technologies, changes in the sociology of it can definitely help. What's your feeling moving forward now that we've had a taste for all the change and all the innovation, but also some of the sensitivity? What do we come to expect in the next few years?
I'm definitely optimistic. I think this is a really interesting point in time because it's an election year, and as usual, candidates are campaigning on a platform of healthcare reform. So it'll be interesting to see what direction we go, post-November, as far as the access we provide for coverage for patients. But generally speaking, I'm optimistic about being able to connect more people with healthcare, and in some cases, healthcare is going to be medicines, and in some cases, healthcare is going to be apps. There are physicians now who are literally prescribing apps, which is very exciting. And just in a lot of ways, we're going to look for how we can continue to kind of facilitate that connection between the entire healthcare supply chain, and pharma has a role in that supply chain because we're starting to shift our value proposition. We're not just about developing molecules and manufacturing them and producing them and commercializing them, right? We are actually about trying to impact the health and wellness of patients. And one of the probably best ways to think about that is, to your point about us living longer and having different diseases to focus on today, there's a counterpoint there that the younger generation, our children, for the first time in the history of humankind, actually have a shorter lifespan than their parents because of the diabetes and obesity epidemic that we're facing in this country and in many countries in this world. And so whether or not a pharma company actually manufactures or markets a diabetes product, it matters to them. You're starting to see that across the board. You're starting to see this whole industry really rally around that cause in particular, as well as some of the other things that we're now shifting our focus to, because at the turn of the century they weren't as important. But Alzheimer's, dementia, specific cancer conditions, as an industry, we're shifting. And sure, some of that new direction in innovation is being driven by the fact that some of our older business models no longer apply, but a lot of that shift is being driven purely by need.
Thanks so much. Lisa Flaiz, folks, Group Director of Digital from Jannsen, talking about pharma, social good, and digital health. It's Spitz signing out from Pixels and Pills at the Digital Pharma East Conference in Philly. Thanks so much, Lisa.